Hi everyone, and welcome to the second episode of the Sunstar Conversation Pro webinar series. For those who are watching for the first time, during this series we'll be discussing oral health challenges across different life stages. Last time we had a very interesting conversation about pregnancy and oral health, and in case you missed it, you can find the entire episode on our YouTube channel. Also, when you go there, don't forget to hit the subscribe button so you'll receive a notification whenever we publish a new video. Now, for today, we'll talk about childhood, and we'll be discussing one of the biggest challenges for this life stage, prevention and management of caries. Before we start, I'd like to remind you that you can ask questions in the YouTube chat function on the right-hand side of your screen. Now, if you're watching on Eventbrite, the event page that you register to, you don't have this option. So then you can click on the Watch on YouTube button, which is on the left bottom corner of your video screen, and that will take you to YouTube where you can ask your questions. So let's get started. And I hope you are as excited as I am, because we have two stellar speakers again for today. And first, I'd like to introduce Lesley Tuomi. Lesley acquired a Bachelor of Science in Dental Hygiene at the University of Minnesota in the US. And currently, she's the Dental Outreach Coordinator for North Point Health and Wellness Center in Minneapolis. Welcome, Lesley. How are you doing?
I'm good.
Good to hear. Good to hear. Thanks for joining us. I was wondering, maybe you could explain in a few sentences what makes you so passionate about the topic that we're discussing today.
To be honest, from the very beginning, when I was in school, just really took an interest in public health. And once I got out into the field and started going out into the community and seeing the problems that some of these children were facing with their teeth, it just broke my heart. And I wanted to do everything in my power to be able to help.
Yeah, sounds like there's a lot to talk about today. So quickly on to the second speaker of today, Professor Svante Twetman from the University of Copenhagen in Denmark. Now, Professor Twetman has published over 270 peer-reviewed papers, which have been also cited more than 10,000 times. And many of those papers were about caries and caries prevention in children. So a very impressive track record. How are you doing, Svante?
Hello, everybody out there, and Martin. I'm pretty fine. I mean, considering the strange pandemic life we are living for the moment, and no, but otherwise it's business as usual, more or less, but in a less clinical way because so much is shut down.
Sounds familiar. When I read your publication and research statistics, that also makes me curious again. Could you maybe share why this topic is so important and interesting for you?
Because all of my career has been split into two things. One is research and one is clinical work, and I'm a pediatric dentist, so everybody can imagine working with children half-time is for over 40 years gives you a really, really heavy and important perspective and input on your clinical research, of course.
Yeah. Again, sounds really promising for the course of this webinar. So let's get started, and let's start by setting the stage. And I would like to start with quantifying how big the problem of childhood caries is. And I want to start with you, Lesley. How big is the problem of childhood caries in your daily work experience in terms of how often does it occur?
Well, with my the particular community that I serve, it is a community that is living in poverty. So even though the U.S. Surgeon General has denoted dental caries as the most common chronic health condition in the United States, these children are seeing that at an even higher than normal rate. I would say more than 50% of every child I see in the schools has active decay.
Wow, 50%. And does that also correspond with research data? This is a question for you, Svante. Are children the group with the highest risk for caries development?
Certainly. In general, dental caries is the world's most common condition, based on the global burden of disease project. And of course, children are the main part, because the most common tooth to be decayed is the first permanent molar. And we have around 700 million children globally walking around with untreated caries in primary teeth. So the problem is super common. It's huge. And considering the fact that caries basically, it's a preventable disease, I would say this is sort of embarrassing that it's so common and so prevalent.
Yeah. I'm trying to pull up a graph, but to show where the incidence and the prevalence peaks lie in caries, but you clearly see a spike in prevalence and both in incidence at the young age, so in childhood.
Yeah, and it's basically the first permanent molar, and again, it's a preventable condition. So it's really, really sad that we still have this high incidence of caries in young children.
Yeah, and how does that relate to actual figures? You already mentioned, Lesley, that it affects up to 50% of the children that you see. How is that for the global burden of the disease? Where does it rank in terms of other chronic conditions?
To be honest, I can't speak to the global burden. Most of the research I've done has been specific to the US, but in the US, it is number one. It is
number one.
Yes.
And does that is that both for permanent or primary teeth, or
both, actually?
Does that, Professor Twetman, does it also correspond to what you know from research?
Absolutely. I mean, one of the main problems is that there are several oral diseases that are ranked high, but I think the problem is that we probably do not consider caries as a disease. For in many countries all over the planet, okay, caries is, caries in the baby teeth, oh, it's not a problem, you will lose them. But actually, caries is a disease, and we will probably come back to this later on. It's not, as many people traditionally has believed, an infectious, transmissible disease. It's a non-communicable disease. And this is so important because that puts oral diseases in the same context as many other non-communicable diseases. And this is important because the dental health professionals are not just dealing with the mouth. We are actually dealing with more than that, not just oral health, but also with general health.
Yeah, I see we've been able to pull up a slide that shows some data, and this is about the economic burden that oral diseases have on society. Could you maybe tell us a bit more, Svante? What are we looking at?
We are looking on the spendings or the costs for oral diseases, and of course this is not just caries in children. I mean, it's also some periodontal diseases and oral cancers, etc. But again, the majority here is caries in childhood. And as you see here, just in Europe, the spending last year was 93 billion euro. And that makes it, to putting it into the context, it is more expensive than respiratory diseases, more expensive than cancers in Europe. I mean, we are close to the cardiovascular diseases, and I can assure you that the picture is pretty much the same also in the United States. So, I mean, we are really looking on an expensive condition. And again, it's mainly and basically preventable, which makes this as a huge, you know, waste of money, if you see what I mean.
Yeah. This is incredible. And I mean, do we need more arguments for prevention? I think already the economic burden is already probably enough.
Yeah, and then you can add on all the personal burden, suffering, losing school, losing work. I mean, you know, there is a lot of indirect costs added that should be added to these direct costs as well. So it's super expensive.
Yeah. Do you see this also in your community that you work in, Lesley? Does it have also a big economic impact on the society and on families with children who are affected by caries?
Yes, it has economic consequences for both the families and also for the state, who is funding some of the care for the impoverished folks that we see. But it does not just those societal burdens, but the individual burdens that Dr. Twetman was talking about, I think are very, very important, because for kids with caries, sometimes this is happening so young that these children aren't able to verbalize what's actually going on. And when they're in a state of pain, and if that pain is frequent or prolonged, it can become a toxic stress in their life. Yep. And that has the potential to change their brain chemistry, and actually the anatomy of their brain too. And that's leading to inabilities to manage mood control, increased anxiety. It impairs their memory. It damages their ability to learn in school. And so I've seen children actually go from a state where they are labeled as a problem child or a behavior management issue, because they're constantly acting out, and then go through treatment, get all of their teeth fixed, get those abscesses taken care of, get to a state where they're no longer in pain. And I can see their personalities actually change. And some of these kids become much calmer, much more able to learn and to function in a structured environment like a school. And so it's affecting not just these children individually, but also their parents and their teachers, and really quite a large group of other individuals who are interacting with them on a day-to-day basis.
So it's as far as I understand, it's far more than just the effects on oral health. It affects even the cognitive development of a child, learning abilities at school. It has much broader effects than just the oral cavity.
Yes, very much so.
That's really that's really impressive. Okay.
And I can only agree, because this is what you see when you're having children with severe dental caries. You take them to the OR, and after a few months, I mean, you are looking on different persons. They are totally changed, and they have catched up a lot of their growth and development. So Lesley is really touching a really, really important, significant point here.
Yeah. Of course, then you're talking about prevention, about treatment, but of course, preventing the issue would even be probably better than not reach that state of disturbed personality and disturbed behavior. That's probably the ultimate aim, I guess. So we'll talk about that a bit later, because I want to go back to the problem of caries and briefly touch upon the etiology. Maybe Svante, you can briefly reflect on that, also to complete the stage setting. What is the etiology of caries? I assume most oral professionals will know, but I think it's worth to reflect on that.
Yeah, and basically this has been known for I mean, decades, that an overconsumption of carbohydrates, and especially the white sugar, a frequent and high consumption, together with an improper daily cleaning and suboptimal exposure to fluoride. All these things are of course acting for a shift, because what we in the oral microbiome, because earlier we thought that caries was a disease that was caused by certain pathogens. And you have all heard about strep mutans as the arch criminal. When we were infected with strep mutans, it ended up with a cavity sooner or later. And in some countries, you know, it was very, very hard. You weren't even allowed to kiss your child or use the same spoon, because then you infected your child. But that is the old knowledge. Today, we know that the etiology of caries is actually, like with all other non-communicable diseases, we have a microbiome. We have a dental microbiome, a biofilm, which we normally call dental plaque. And as long as the composition in the biofilm is diverse and stable, this is associated with health. And we need the microbiome, we need the bacteria, because they clearly help us to maintain healthy conditions. When these stable biofilm is stressed, for example, by sugar or improper cleaning, the composition will shift, and you will have a reduced diversity, and you will have an unstable conditions, and this is called dysbiosis. So what's happening is that we have the normal commensal healthy microbiome. Stress factors is shifting this composition towards an unhealthy, with an overabundance of some bad bugs that actually together in clusters change the environment for the teeth, resulting in decay and demineralization. So it is actually when we have unfavorable conditions affecting our healthy microbe, transfers it to a dysbiotic condition. And this is also what happens in periodontitis, in diabetes, and in many overweight, etc., etc. So basically, the principle is there.
Yeah, and you know, apart from the etiology, you mentioned the non-communicable aspect of caries already. What does that exactly mean? Has that to do with certain risk factors that go beyond oral health? Could you maybe elucidate a bit on what actually is that aspect?
It actually means that the caries or oral diseases share a lot of common risk factors with other diseases, which means that, for example, yes, we are trying to reduce the intake of sugar, and that has an impact on dental caries, but also on overweight in children, and in the long run, probably also diabetes. Yeah. If we are, trying to work anti-tobacco for periodontal patients, that is also helpful for, cancer and a lot of others. So I think that we should put the risk factors that we have. It's important for the oral diseases, but they also are of importance for a number of other non-communicable diseases. And therefore, we should join our efforts and work over the different health professional groups and mix our skills to actually provide a better preventive message.
Yeah, I was wondering, Lesley, for you, how do these risk factors that we mentioned, like overweight, certain lifestyle factors, how do they come to life in your work? Is that an important thing you see in daily practice?
It's a very important thing that I deal with on a regular basis. The area that I serve is considered a food desert in the state of Minnesota. And what that means is that there is only one grocery store for literally miles and miles. And so there's not a lot of options for people to find healthy foods. Even though there's only one grocery store, there's lots and lots of McDonald's and fast food options. And so people tend to eat those cheaper, less healthy foods, because for them to go to the grocery store, a lot of times they're taking public transportation or they're walking. And we're in Minnesota, where sometimes it's 40 degrees below zero. And I guess that's in Fahrenheit. But it gets very cold here in the winter. So for somebody to walk several miles in one direction to go buy fruits and vegetables and then carry all that stuff home is just not a realistic expectation, when they could go across the street and find something much less healthy. And so a lot of times people choose the less healthy option because it's more convenient. And so that's one thing that I've been working with, is to try to incorporate healthier options into the neighborhood.
Yeah, that sounds great. I think we'll get to that stage later as well, because you have some other examples that that we can do as a oral care community. But we'll come later to that. Yeah, sorry, sir.
No, if I just may add, also caries is, we have the etiology is of course super complex, with all these biological and socioeconomical and lifestyle factors, etc., not to mention genetics. But as Lesley said, it's another problem is also that the bad eating, the high sugar content foods are cheaper than the healthy food, which is also a problem, because not just for accessibility, because it's also, I mean, it's much more expensive to buy a healthy salad compared to an unhealthy junk food, etc., etc. So, I mean, there are when we are later talking on prevention, there is so many more. You can just say, reduce your sugar intake. That will reduce the stress in your biofilm. I mean, it's not that simple.
Yeah, and I think that really takes us to sort of the basic. Could you maybe share a bit on talking about actual prevention? What are the key pillars of caries prevention, so to say?
Will you start, Lesley, or?
I certainly can. Well, we had discussed at one point some of these pillars being the biofilm, the oral hygiene, the fluoride. I would also argue that education is key to this, because we hold all of that education. We went through dental school. We know what is causing caries, but unless we educate not just other health professionals, but other professionals in every area of society, that education isn't doing enough, in my opinion. I think that it's important to work with people who can make the changes that need to be made. For example, going back to this discussion about eating and diet, one thing that I have done or worked with others on is one of the high schools in my neighborhood had vending machines that were selling juices and sodas. And so kids were coming in with pockets full of change and having easy access to all of this sugar. And so I actually worked with the school administration to have the vending machines removed so that they didn't have that access anymore. And without, I guess, me just constantly talking and bothering other people and trying to share that knowledge that I have, it's just those little things that get missed. And the majority of society does not understand dental disease. They don't understand how important it is or the effects that some of these choices can make. And so their decision to bring soda or vending machines into the school was to try to, I'm sure, keep the children hydrated or give them options for drinks in between classes. And they didn't realize the problem that could cause. So just constantly educating everybody around you about the importance of oral health, I think is so important.
So that goes beyond just patient education. I assume there's it's more than that. Sorry, Svante, you wanted to comment on this?
No, I fully agree. We have 4 pillars. We have regular oral hygiene, which is important to that you disrupt the biofilm on a regular basis. Otherwise, it will grow more mature, more thick, and more complex. The other one is to reduce sugar, obviously, and especially the free sugars. And according to the WHO guidelines, children under 2 should have no added free sugar whatsoever. So I mean, we have solid guidelines for caries and overweight to rely on. Then we have fluoride, and we have education, and all these are of course important. But if you look upon it from an evidence-based perspective, what is actually working? I mean, you have to pick fluoride because it's easy to say reduce sugar, not easy to achieve. It's easy to say clean, but it's obviously not possible for everybody. And again, not every child over the planet has access to a toothbrush, etc. But fluoride, it's pretty, it's a low-cost thing. We need to put fluoride in the biofilm 24/7 because fluoride works only when it is incorporated in the biofilm. It hampers the stress from sugar, and it actually has a certain antimicrobial effect as well. So, I mean, the evidence-based, the most effective way from an evidence-based perspective is to make sure that everyone living on this, every child on this planet have fluoride available in the biofilm 24/7. And this is the most, I mean, it's not easy, but it is probably the most effective single measure that you can introduce and achieve. And again, another important thing is, because people ask, oh, what kind of fluoride? The biofilm never asks, does the fluoride come from a toothpaste or from a rinse or from a varnish, blah, blah, blah. The biofilm doesn't care. So, I mean, what we have to figure out is what type of fluoride exposure works in Lesley's community, in Africa, in Scandinavia, etc., etc. So, but if you have to pick the single most effective with the highest evidence, that's fluoride. That doesn't mean that education, etc., is not important, but if you have to choose, yeah.
Good point. Good point. So, what are the, Lesley? What are in your experience the biggest challenges? Why it is so important to bring these pillars of prevention to life? Also, the education part. I mean, I can imagine that it has to do with certain differences between societies, but what are the biggest challenges that you face in bringing this to life?
Well, in speaking to what Professor Twetman was just discussing with the fluoride, I've noticed a huge increase in the number of parents that are refusing fluoride and that are listening to media talk about how fluoride is a poison. And I don't know if this is just localized to my area or if this is happening other places. But again, we've got to, as oral health professionals, we have got to get the message out there that fluoride is important, that fluoride is not poisonous, that fluoride is actually a tool, and a very important tool in our toolbox to help prevent this disease.
Yeah.
Yeah, and one argument could be, I mean, we all know that if we can make sure that fluoride is available in the biofilm, we can allow us to eat less perfect, to have less perfect lifestyle, etc. And Lesley, this is global. I think probably it's more, I mean, the anti-fluoride is probably more or less active in different parts of the world. I know that there is a discussion in America, but we have it also here. And to me, this is another. You cannot say, "Oh no, it's not dangerous. Your kid is not getting mentally retarded. Don't worry." I mean, you have to respect the parents, what they think, and then I use it as an argument, because then I say, okay, you can skip fluoride if you make sure that you keep the sugar intake to less than 5% of your total energy intake, because that's what you can read in the WHO guidelines. 10% is what is strong recommendation, but they also have a 5% level. If you keep the sugar intake lower than 5%, you don't need fluoride. I mean, in those cases, you actually can maintain your oral health without fluoride. So I asked them, okay, no honey, no syrup, no, and keep all the free sugars away from the child. In that case, you can actually skip fluoride. And then they realize, that's not easy. So, but that gives you a way of discussing how fluoride and the lifestyle and the sugar actually, it gives you an opportunity to discuss all around these things.
Yeah. Continuing on this preventative measures that you can do, Lesley, I think you also had some ideas of things that oral care professionals can do outside of their dental office. We've been talking about it, what can we do inside our office in terms of prevention, but you also had some ideas on what they can do outside the office, and I will try to pull that up at the moment, see if it works. And because you had some really nice ideas, there it is.
My biggest message for dental professionals is just to get out into your community and do anything you can do. Talk to anybody who will listen. And so I do a lot of volunteer work. I go out into all kinds of community events. I guess since COVID started, there's not as much going on, but there are usually events at churches or libraries or parks or through different like 5K events or different things going on where I will just say, hey, can I set up a table and come and volunteer? I'll give away some toothbrushes, and they're more than willing to have me come. At some events, I'll even do screenings where I'll look in the mouth and give people a little report card of what I see. And so just it gives me a chance to interact with people one-on-one outside of the operatory. I can talk to a lot more people in a few hours, sometimes hundreds of people, versus me being able to just see the patients at the rate that they come into the operatory. Also, if you can get into a school, that is an amazing thing to do. I actually run programming where we go in and we provide health screenings for about 1,500 students a year. But there's other schools where I've just volunteered to go in and do an age-appropriate educational piece on how to brush your teeth, or the importance of fluoride, or all kinds of different topics. But I make it fun for the kids. Sometimes I bring in puppets or different things. And the feedback that I've heard from parents on that is that it does motivate the kids to go home and brush and to kind of pay attention to what they're doing. You can, again, look at things like community centers or schools with, do they have vending machines? What's in those vending machines? Do the people who put them there know, do they have that base knowledge to know what the items in that vending machine could potentially do to the people purchasing them? I've worked with policymakers to try to make changes, because I know that in my state, in Minnesota, it is a law that before children start school that they have a vision screening and a hearing screening. but there's nothing saying that they need to see a dentist. And so we're working to try to change that. What else have we done? We've worked to provide transportation or incentives for people to actually come in and be seen or to complete treatment plans. I've given bus tokens so people can come into the dentist when that's been a barrier. I've given electric toothbrushes as a reward for completing treatment plans for children. And I know that some of this stuff I'm talking about does cost money, but don't be afraid to ask for donations. I've gotten lots of stuff from Crest. I know that Crest always has field reps in different areas. I've talked to them and told them, hey, this is what I want to do, or this is what I'm going to be doing. Can you help me? And they've donated all kinds of oral hygiene products. I've written grants to get funding to purchase items that I've needed. So really, I encourage everyone to just think outside the box, because you can touch so many people outside of the dental clinic if you just keep talking, basically.
Yeah. What do you think, Svante? This sounds like
I can just agree with Lesley, but and I am in support of all outreach activity and school-based activities, kindergarten-based things, and fortunately in Europe we don't have to look for fundings because all these or such activities are funded by the government and the states, which is good. And
I assume not everywhere in Europe, maybe. Maybe not everywhere in Europe.
No, not everywhere, but in many parts of Europe, and especially up north. Yeah. But it's important. I support it, but it's also important to underline that there is not one size that fits all. All these outreach activities and programs, they must be locally adapted. For example, in low socioeconomic communities with a lot of immigrants, refugees, etc., you have to stress certain things or other things than you do in a middle class community, etc., etc. But I certainly agree that there are, if you find an appropriate way from the cultural perspective to bring fluoride in the biofilm, I mean, it's fantastic. In some countries or in some areas, fluoride tablets works very well. In some other, it's toothbrushing. In some others, it could be mishwak, etc. But also and there are so many things that we do not use or maybe underuse. And just to mention those educational video games that actually are very, very helpful for school children to learn and improve their understanding of oral and general health. So, I mean, we need to be global. We need to have the 4 pillars that are global, of course, but they must be adjusted locally to the target group that we are actually addressing. And that goes from very, very small, from parents with babies with Head Start programs, etc., up through the school years, because I mean, in some countries you are happy if you can just have supervised toothbrushing in schools. In other countries you can do fissure sealants in schools, etc. So again, there is no one size fits all. It must be adjusted to where you live and the funding or the donations, etc. So here we need to think, as Lesley said, in a very, very creative and be open-minded. But whatever we do it for the oral health of the children.
Yeah, I totally agree. And I also really liked your point you made, Lesley, on the influence that you can have as an oral care professional on policymakers and maybe insurance companies.
Yes.
That I assume has a big potential. If these bodies of government draw up guidelines, for example, and you can have a voice there. If you can join forces as an ORCAD professional community and join forces and really influence the drafting of those guidelines, I think that is really powerful, because it can actually influence real life policy. It can have effect on the national scale, for example. I think that's also really powerful. And I remember I recently read a paper that said that by adding information on the front label of a packaging, for example, on nutritional value or on the amount of sugar in there, that had a big effect on caries development, and it really decreased the rates of caries over I think it was a course of 10 years. And that's probably because of a strong lobby of groups or communities like ORCAD professionals. So I think by influencing these policymakers, you can really have a big impact.
Yeah.
Oh, very much so.
Yeah, and I mean, just to inform you that we are actually working on a project to inform the World Health Assembly at the WHO, because and the purpose of this is, of course, to bring increase awareness of the importance of oral health, considering the costs. I mean, it's the world's most common condition. It's super expensive, and it affects the quality of life. And I think, as Lesley said, we need to bring this and upwards to increase the awareness, because it's a global. It's not just a few countries. It's a global thing, and therefore, it should be up on the agenda, and we're trying to do this.
Yeah, sounds great. I see we have a little less than 5 minutes remaining, so I think it's time to see if there's some questions coming from the audience that we can maybe answer. When do you start to speak about interdental cleaning with children? That's an interesting question.
I actually start right away. I have some little tooth suits that I have. I actually sewed them, but it's a little costume that I made when I go into preschool and kindergarten classrooms, and I have the children dress up as teeth and then stand shoulder to shoulder. And then I have a big toothbrush where I can show them that I can brush their fronts and their backs, but I can't brush in between. And so we use a rope to go in between the children that are standing next to each other. I've made little mouths out of cardboard and I glue marshmallows in there to represent the teeth, and I have the children practice flossing that way. I really believe the earlier you can start this, the better, because even if the parents aren't doing it at home, I've had kids go home and ask their parents to floss their teeth. And so if I can just introduce that idea, I think the earlier the better, honestly.
Yeah, and I think we also forget that the kids are probably learn easier than we do. So they're smarter than we think, probably.
Oh yeah, they're very smart.
I totally agree that they are smarter than we are, but probably we sometimes try to be too smart. I have a different opinion here, because we do not, interdental cleaning with flossing, etc., is only recommended on individual indications. I mean, we are not allowed to do it on general recommendations, simply because there is a lack of evidence. As you know from the Cochrane collaboration reviews, there is a lack of the certainty of evidence for interdental cleaning for proximal caries progression in children is very, very low. And therefore, we do, of course, recommend it for older children on individual indications, but not as a general measure. So here we are a little bit, but still, I think what Lesley do is fantastic. So we have to realize that we need to adapt everything in a local manner.
It's interesting to see these differences between regions. I mean, it's really interesting. Let's see if we have another question. Is the use of oral tablets, FNA, in the public health programs to England? Not sure if I understand or read the question correctly. We're going to the next one already. What is your opinion about probiotics for kids? This is a nice question, and I think I read a paper published by you, Svante.
Yeah, in this aspect, I'm pretty much I'm biased because I have done around 20 years of research on probiotics, and it boils back to the fact that the oral biofilm is actually formed according to the first come, first served basis during the first 1,000 days of life, which means that from the moment you are born and the first 3 years of life is so crucial because what you are exposed to and the timing of which type of bacteria that you are exposed to during the first 3 years of life will actually have consequences for the rest of your life. And therefore, an early exposure to the beneficial bacteria for maintaining oral health is, in my opinion, a smart choice. So an early start is smart, and we have compiled a number of studies on prevention of early childhood caries using probiotic supplements, and they are in favor for adding probiotics, especially the early in life for preschool children for preventing caries. So I mean, but I'm a little bit biased because this is really my heart topic in research for the moment. But if you ask me personally, I would support that.
Okay, interesting. I see we're already running a few minutes over time, so I'm really afraid this is all the time that we had today. If you've asked a question and it hasn't been answered, don't worry. We will make sure that the answer reaches you after the webinar, that we can share with you individually. So yeah, I would like to end the conversations of today, and of course a big thank you to our speakers of today. Lesley, it was a real pleasure to talk to you and hear your experiences in the field.
Thank you.
And keep up the good work, Lesley. It's impressive.
Absolutely.
I will.
And yeah, thanks to you as well, Svante. Thank you so much for your expertise and for sharing your knowledge today.
My pleasure.
Yes, thank you.
Yeah, and of
Stay
course,
safe.
we will stay safe, definitely, and enjoy, of course, your Easter break. And of
Thank you
course,
very much.
also a big thank you to everyone who's tuned in today to watch our conversation. And don't forget to like this video and hit the subscribe button to this channel. I will be back in 5 weeks on the 6th of May, same place, same time, and we'll be discussing oral hygiene during orthodontic treatment and how to make it attractive for, you got it, teenagers, our next life stage. So thank you again, and I catch you all next time. Bye bye.
Toodaloo. Bye.